Good morning. I am Dr. Zaman. In this presentation, I will discuss the assessment and management of a 24-year-old pregnant woman, Amina, who presents to the emergency department with lower abdominal pain and nausea at 16 weeks of gestation. Amina and her husband are recent refugees from Sudan and speak limited English. Her husband answers most questions and Amina appears anxious. Given the language barrier, I would immediately engage a professional interpreter. This is essential not only for accurate communication, but also to support Amina's autonomy and comfort. It is appropriate to rely on her husband to translate in a clinical setting. Cultural sensitivity is also crucial. Amina may prefer a female doctor or chaperone, especially for physical examination, have traditional beliefs about pregnancy or pain, be unfamiliar or mistrustful of Western healthcare systems. I would acknowledge these possibilities, explore her preferences, and ensure she feels safe and respected. Ethical consideration. On key ethical issue is respecting Amina's autonomy. While her husband may be trying to help, it's important to make sure Amina feels empowered to speak for herself. Using the interpreter, I would speak directly to Amina, privately if needed, to confirm her consent to the consultation and examination, whether she feels comfortable with her husband's involvement, her understanding of any test or treatment options. All procedure would be explained clearly and informed consent would be obtained in her own language. Initial clinical priorities. My immediate clinical priorities is stabilizing Amina and assessing her vital signs, evaluating fetal well-being, ruling out obstetrics and surgical emergencies. The differential diagnoses include obstetric causes such as threatened miscarriage or round ligament pain, non-obstetric causes including urinary tract infection, appendicitis, or gastroenteritis, less likely but still important to consider ectopic pregnancy. Assessment approach. I would begin with vital signs to check for sepsis or instability, abdominal exam to assess tenderness or guarding, fetal heart sounds via Doppler, urine dipstick and bedside ultrasound, a speculum and bimanual exam if needed and with consent. Additional investigations may include blood test, urinalysis, and a pelvic ultrasound depending on clinical findings. Management would be tailored to the diagnosis, reassurance for round ligament pain, antibiotics if a urinary tract infection is confirmed, urgent imaging and referral if appendicitis or other acute cause is suspected, obstetric team involvement if there are concerns for maternal or fetal health. Regardless of the diagnosis, I would keep Amina and her husband informed in a culturally sensitive manner, engage a social worker or refugee health liaison officer if needed, document all discussions, including interpreter use and patient preferences. In summary, this case highlights the importance of combining clinical skills with cultural awareness and ethical care. Clear communication, respect for autonomy, and compassionate engagement are vital to ensure the best outcome for Amina and her baby. Thank you.